Eskenazi Health perioperative services. We know that the thought of undergoing surgery can be intimidating, and it's normal to feel a mix of emotions, including anxiety. Many people worry about what to expect, and the fear of the unknown can make the anticipation even more nerve-wracking. Our hope is to ensure that you feel confident and supported at every stage of your surgical experience, from your initial consultation to your post-operative follow-up appointment. Remember, we're in this together, and we're here to answer any questions you might have along the way. Every patient scheduled for surgery will begin their journey with a phone call from our pre-anesthesia team. During this call with a nurse, we will gather a detailed medical history. We will ask about any pre-existing conditions and address concerns that may need attention before your surgery. We will give you instructions on when to stop eating and drinking before your procedure and how to take your medications before surgery. Our goal is to make this process as smooth as possible for you and to ensure you're fully prepared for your upcoming surgery. You might be asked to come see one of our nurse practitioners for a more thorough assessment and perhaps some testing.
We're gonna go over with your medical history and go over with your medication. Make sure that you are safe to go under general anesthesia, okay?
On the day of your surgery, you will come to our preoperative department to get ready for surgery. Once you are registered at the front desk, a nurse or care tech will bring you back to the department. Your height, weight, and possibly a urine sample will be obtained.
My name is Carl again, okay? I'm the patient care tech, and take your vital sign and explain you how to get yourself ready, okay? All right, right here, like this. Right. Okay. This is how you're gonna get yourself ready for today, okay? You're gonna put this gown on you. The open part of the gown will go on your back. You will have to remove everything, your underwear will be included as well. And all your clothes, everything that we're gonna keep for you, you're gonna put them into this plastic bag, okay? And after the nurse will take care of them for you by putting them in the locker, so everything will be safe, okay?
At Eskenazi Health, we use a 3-step cleansing process to reduce the risk for surgical site infections. This includes using antibacterial wipes on the skin, brushing your teeth, and cleaning the inside of your nose. Your nurse will then come in and review your health history, prior surgeries, medications, and more.
Hi, good morning. My name's Maya. I'll be the nurse getting you ready this morning, okay? Perfect. Were you able to get ready okay? Awesome, okay. And who do you have here with you?
This is my brother, David.
Perfect. So to start off, I've got lots of questions that I have to ask you. Questions that I ask everyone. Do you have any metal in your body anywhere?
No.
No, any implants, like in your heart, stents?
No.
Perfect, okay. Any loose teeth, dentures, or partials that you can take out? I'm gonna put a couple things on your legs. These help with blood flow during surgery. So from here, once I get you ready, I'll have to get an IV placed on you. The anesthesia team will come in and talk to you, consent you for that as well. And then the surgical team will also come in and consent you for the surgical part of it. Make sure you have any questions. If you have any, ask them then. They can answer it for you. After everyone has came in and seen you and talked to you, then the OR nurse will come in as well, hand you off, and then you'll roll back to the OR.
All right.
Hey, Mr. Oates. Hey, I'm Dr. Gray. I'm one of the anesthesiologists. How are you doing today?
Good, how you doing?
Very good. Nice to meet you. Who's this here with you today?
This is my brother, David.
Nice to meet you.
Nice to meet you.
So today I want to go over your past medical history, go over the game plan, complications, and have you sign a consent form for anesthesia. Sound good?
Yep.
If you're okay with everything, then I'll just have you sign right here next to the sex. Okay?
My name is Kelly. I'm going to be the nurse taking care of you in the operating room. Do you have any questions for them about what to expect moving forward?
About how long is it going to take?
We are booked for about 2 hours. It could go a little bit longer depending on the severity of the case, but we're expecting everything to go smoothly. Are you ready to roll?
Yes, I am.
Let's do it.
Your support person will be escorted to the waiting room once you leave for the operating room. They will be able to track the progress of your procedure on our tracking boards throughout the waiting room. When you arrive to the operating room, you will be greeted by the anesthesia team, surgical technicians, and other staff who will assist during your surgery, whose priority is your safety. The operating rooms are usually cold and bright, but we have warm blankets to make you feel comfortable. The nurse will give you instructions on moving to the operating room table, positioning, and will tell you what you can expect before, during, and immediately after anesthesia. Depending on the type of anesthesia you receive, your anesthesiologist will then administer oxygen and/or medications through your IV. Once surgery is complete, the anesthesiologist will wake you up. you will be taken to the post-anesthesia care unit by the OR team. When you arrive in PACU, your nurse will be waiting in your assigned bay and connect you to the monitor to evaluate your vital signs. The OR team will give your nurse report about your surgery.
My name's Ken and I'll be taking care of you while you're in the recovery room, okay? Are you having any pain at all? Any nausea? Okay, I'm just gonna close this curtain and take a look at your incisions, okay?
If you are going home after surgery, your PACU nurse will review discharge instructions with you and a responsible individual. Once you have met discharge criteria, we will help you get dressed, remove your IV, and escort you out of PACU in a wheelchair with your responsible individual. If you are being admitted after surgery, you will wait in PACU until your room is assigned. This could take a couple of hours or longer depending on the volume of patients already in the hospital. Once you have been assigned a room, the PACU nurse will call report to your new nurse and transport you to the assigned room. In the days and weeks following your surgery, you may receive a phone call asking about your care and recovery. It is important for us to follow up with you so that we can address any concerns you may have. Surgery can be stressful, especially if you have never had surgery. We are committed to providing a supportive environment to you. Thank you for choosing Eskenazi Health. We hope you have a speedy recovery.